MC Award. Of course, you do know on the program as always bringing a round peg in a round hole. Someone who would definitely know their onions well. And today is not an exception. It's a pleasure having Dr. Bolanle Akinwonmi join us on the program this morning. Glad to have you join us, ma'am.
Thank you, Ma, for having me.
All right.
Good morning, listeners at home.
ẹ ṣeun gan ni láì tún fi àkókò ṣòfòjá sọlédè àbínibí wa ìyẹn náà la fi ń kí n pẹ́ káàbọ̀ sórí ètò wa ètò yín ìlera lọ́rọ̀ pẹ̀lú ìbáṣepọ̀ Nigerian Medical Association ìyẹn ti ìpínlẹ̀ Ondo ń bí adẹ̀tí ẹni tó ń dáńtọ́ ta gbé wá sórí ètò lónìí àwọn náà ni consultant pediatric and special care dentist yes ní FMC ní ìlú Ọ̀wọ̀ àti dárúkọ wọn lédè Gẹ̀ẹ́sì lẹ́ẹ̀kan padà tó dárúkọ wọn náà ní lédè àbínibí wa àwọn náà ní Dókítà Bolanle Akinwonmi ẹ káàbọ̀ sórí ètò lẹ́ẹ̀kan sí.
Ẹ ṣé olóòtú, ẹ káàárọ̀ ẹ̀yin ará lé o.
N tá a dẹ̀ ń gbéyẹ̀wò lónìí náà ni effect oògùn ní ẹnu wa ní àgọ́ ara wa effect of medications on oral health that's what we're looking at nǹkan tá à ń gbéyẹ̀wò náà nìyẹn gbogbo effect ká máa gbélé sẹ́nu ohun tó ń ṣe pẹ̀lú gbogbo èémí tó ń jáde ní ẹnu wa effect àwọn oògùn tá à ń lò yẹn òun lọ́mọ bá wa yànnàná lórí ètò lónìí orúkọ tèmi ni Comfort Ọmọláfẹ́ ká tó mẹ́nuba ohun ká tó bẹ̀rẹ̀ sí máa béèrè àwọn ìbéèrè lẹ́ẹ̀kọ̀ọ̀kan ká máa mú lẹ́yẹ kọ̀ọ̀kan fún àlejò wa lónìí ẹ jẹ́ àdókè lọ́nà ẹ má yí kúrò ńbẹ̀ ìkànnì lálùbáríkà náà lè ṣe tẹ́tí sí Glow 99.1 FM. It's Glow Health Talk with NMA, Nigerian Medical Association, Ondo State Chapter. And we're looking at the effect of medications on oral health, your oral health, my oral health. And today we'll have quite a number of questions to ask our guest. And in case you have questions to do well to call us in due time. Let me give out the phone numbers 0805 551 1110 or 0706 6771822. Remember, we're live on Facebook at Glow 99.1 FM Akure. You may also listen to us live on Radio Garden or download the Glow FM app on Google Play Store. Very quickly, Dr. Bolanle Akinwonmi, what do you understand by oral health? And is it the same thing as oral hygiene?
All right, thank you. When we talk of oral health now, let me start with the oral. We are talking about everything that has to do with our mouth, structures that are found inside the mouth. When we talked about the health of that oral space, we are talking of it being in a state of no disease and it is functioning normally. There is no pain, there is no problem with the mouth. Now, when you now talked about the oral hygiene, you are talking about the measures that we take personally to take care of that environment, to make it clean. So when you have a good oral hygiene, it will ultimately give you a good oral health.
Ṣeun gan ni tá a ti sọ lédè Gẹ̀ẹ́sì yẹn máa fẹ́ kẹ́yìn náà lédè abínibí wa kí ni wọ́n ń pè ní oral health gangan ìlera ti ẹnu bẹ́ẹ̀ ni àti ṣé ó tún jẹ́ àwọn tó tún pè ní oral ṣó yàtọ̀ síra bó jọra wọn yẹn oral health àti oral hygiene bá ṣe lè ṣàlàyé náà ní kẹ́ ṣàlàyé lédè abínibí wa.
Ok, tá a bá sọ̀rọ̀ oral health yẹn oral ó mean ẹnu ká fi sílẹ̀ bó ṣe wà yẹn gbogbo nǹkan tó wà nínú ẹnu wa ìwọlé yín ẹ̀kẹ́ wa nínú ahọ́n gbogbo ẹ̀ àjà ẹnu that is àwọn nǹkan tá à ń pè ní oral nìyẹn so health ni ìlera so ìlera gbogbo àwọn nǹkan tó wà nínú ẹnu wa yìí tó yẹn pé kò ṣàìsàn kò dẹ̀ dùn wá a lè fi jẹun a lè fi sọ̀rọ̀ gbogbo nǹkan tẹ́nu máa ń ṣe a lè ṣe láì ní ìrora tá a bá wá sọ̀rọ̀ ti hygiene yẹn o à ń sọ nípa ìmọ́tótó gbogbo àwọn kan tá a máa ṣe láti rí i pé ẹnu wa wà ní ìmọ́tótó so ẹni tó bá wà ní ìmọ́tótó á wà ní ìlera.
Ẹ ṣeun gan ni ẹ jẹ́ ká mẹ́nuba ìbéèrè mìíràn kí ni àwọn special attributes kó tó di pé a lọ síde Gẹ̀ẹ́sì kí ni àwọn special attributes tí tó wà ní oral cavity wa tó dẹ̀ predispose it láti máa wà affected pẹ̀lú medications tí à ń mú sẹ́nu àwọn oògùn tá à ń lò Mo lérò pé ìbéèrè yẹn mo try as much as possible láti mix ẹ̀ papọ̀.
Okay, ẹ ṣeun olóòtú. Tá bá sọ àwọn nǹkan tó jẹ́ pàtó nípa ti ẹnu àti àwọn nǹkan tó wà nínú ẹnu wa tí àwọn oògùn tá à ń lò tó lè affect. Ọ̀nà méjì ni ká kọ́kọ́ pín sí ná. Ká kọ́kọ́ rò pé àwọn ilé ìtalò tó pọ̀ jù àti àwọn ilé ìtalò tí ò tó. Then àwọn ilé tó jẹ́ pé bóyá àwọn dókítà ló kọ fún wa tá à ń lò lójoojúmọ́, bí àwọn kan wà báyìí tó jẹ́ pé wọ́n ní ẹ̀jẹ̀ ríru àbí ìtọ̀ ṣúgà àti ohun tó jẹ́ ojoojúmọ́ náà sọ fún wọn kó máa lo oògùn. Ṣé ti wá rí àwọn oògùn tá à ń lò yìí, ẹ̀yin náà mọ̀ pé gbogbo nǹkan tó ń lọ sí àgọ́ ara wa apart from àwọn ilé tó jẹ́ pé wọ́n fi ń fún wa ní abẹ́rẹ́, ẹnu iná la máa ti lò sínú ara. So àwọn nǹkan tó dẹ̀ wà nínú ẹnu yìí àti ẹ̀kọ́ ìjìnlẹ̀ ti fi yé wa wípé láti ìgbà tí obìnrin bá ti ní oyún ọmọ láti bẹ̀rẹ̀ láti bíi 3 weeks ọ̀sẹ̀ mẹ́ta tí obìnrin yẹn ti lóyún ọmọ yẹn ti bẹ̀rẹ̀ sí ara àwọn structure tó wà nínú ẹnu yẹn bíi bóyá ìwọ ni eyín o, ìwọ ni ahọ́n o, ìwọ ni àjà ẹnu o, àwọn mucosa tó láì ní ẹ̀kẹ́ yẹn gbogbo ẹ̀ láti 3 weeks yẹn ló ti máa bẹ̀rẹ̀ sí ní develop díẹ̀díẹ̀ títí tí tá fi dàgbà dé sí. So at any stage of that development ni àwọn oògùn tá à ń lò yẹn tó ti lè affect wa, and because the development takes from that 3 weeks till adulthood, that long process and complex process can predispose that oral cavity to having affectation by that. Then apart from ìyẹn náà tẹ́ bá wo ẹnu wa ẹ rí i pé ẹnu nǹkan tó fẹ́lẹ́ ni, àwọn skin tó line ẹnu wa kì í fi síbẹ̀ ẹ pé wọ́n thick bíi tẹran ara. So bó ṣe fẹ́lẹ́ yẹn ó easy fún anything tó bá wá bí àjèjì àti ṣàkóbá fún, like what the Englishman would say irritation, ìyẹn náà wà ń bẹ̀. Then two, tẹ́ bá tún wo ẹnu yẹn àwọn nǹkan tó gbé ẹ̀jẹ̀ wọlé which we call the blood vessels wọ́n pọ̀ nínú ẹnu bírú ahọ́n báyìí pé tí ahọ́n yàn kan bá gé báyìí ẹ rí i pé bẹ́jẹ̀ ṣe máa tú síta, we have richly supply. So because of that bẹ́jẹ̀ ṣe ń flow yẹn ṣe àwọn medications náà they are absorbed into the blood system. So their effect to get to the mouth from time to time. Then the mouth itself bí ó jẹ́ an enclosed cavity ó ní àwọn microorganism bẹ́ẹ̀ ṣe wá jókòó síbi ìsìn àwọn microorganism kan tá à ń pè ní microorganism bacteria kí n kàn fi ṣe bẹ́ẹ̀. There are some tó yẹ pé wọ́n normal sí ẹnu everybody. So in that normal state wọn lè fa àkóbá kankan sí ara, but tó bá ti di pé we now introduce substances like in form of medications, chemical that can disturb that normal arrangement. Ṣé mọ̀ pé àwọn tó jẹ́ pé wọ́n ti ń gbé ní ìrẹ́pọ̀ tẹ́lẹ̀ wọ́n lè dàrú, so thereby predisposing to so many reasons why the mouth is.
Ẹ ṣeun gan bó tẹ̀ jẹ́ pé ẹ sọ lédè Gẹ̀ẹ́sì dé àmọ́ fún àwọn tí ò tiẹ̀ gbọ́ èdè àbínibí wa rárá, I'd like to ask you to please expatiate on the special attributes of the oral cavity that predisposes it to being affected by the medications that we take inside our body.
Okay, thank you. So what I have said so far, I said the structures that are found within the oral cavity, for instance, our tongue, the teeth, let me just limit to that two for now. You know, their process of development starts during 3 weeks intrauterine life. That's when the woman is pregnant and the pregnancy is 3 weeks. Science has proven to us that those structures, their formation are being laid down, and it takes a long and complex process for them to be fully formed. So at every stage, if any medication is applied that can insult those structures, it predisposes them to that. So let's say that long process of formation predisposes the oral cavity to affectation by medications. Then I also talked about the thin layers of the oral mucosa. That's the lining of the mouth. So because of that, it predisposes the mouth to easy irritation by substances. This time around, we are looking at the constituents of medications. Then I talked about the rich blood supply. That's to the oral cavity. So anything that affects blood volume supply to the oral cavity, that is increasing or decreasing it, of course, we will manifest. Then there are some structures too, like you have our salivary gland that produces saliva in the mouth. There are some medications that can affect the function of that salivary production. So it will also affect. Then I talked about the normal milieu of the microorganisms that are present in the mouth that in their natural habitat are not harmful to the mouth. But when you introduce substances that either increases them or disturbs their functions, it can also predispose to effects.
All right, that brings me to what are these substances or what classes or group of medications, can affect our oral health and what are their effects? I don't know if you.
Yes.
Yeah. Okay.
Yes.
Okay.
So many.
Okay.
So many. In fact,
and I would love you to please expatiate on it because we
yes.
need to learn.
Yes, I will. Then I'll try as much as possible to start with the very common ones.
Okay.
That affects almost everybody or a good percentage of the population because, like I said, there are so many. So, but for me to make it easy and so that we can follow a line of thought, let me put them in categories.
Okay.
For instance, I talked about the development of the mouth and the structures that are there. So let's start from at that stage of development and take it to before the child is born. That's the prenatal, that's at pregnancy level. Then we look at when that child, let's look at one individual now. We look at when that child is given birth to,
Okay.
and then we look at the process into adulthood as the child is exposed to those medications. So let's talk about this life that is beginning at 3 weeks. I told you about structures that are being formed and it takes a long process. If a pregnant woman is exposed to some drugs, to some medications, we have a lot of them. That there are some pregnant women on anticonvulsants, for instance. There are some of them on anti-epileptic drugs, some on steroids, some even antibiotics that are not supposed to be taken at that time, if carelessly. Like the common one everybody knows, I'm sure you will have heard of tetracycline stains
Of course.
on the teeth. So if at that formative stage, a pregnant woman is exposed to it, that has an effect on the oral structure of that patient.
Okay.
Then there are some that has been implicated even in the formation of the whole, like you've heard about children having cleft lip and palate because their parents took something that they were not supposed to take as a predisposing factor. Some like corticosteroid, now use of it, excessive use of vitamin A, hypervitaminosis, and so on and so forth. Some patients on anticonvulsants, they can like carbamazepine, like that, it can give rise to the formation of cleft lip, whereby during that process of development, a segment of either the lip or the alveolus or the palate will refuse to fuse because of that substance that was introduced to it. So that's another effect on that. Then apart from that, during that process of development too, there had been the laying down of the enamel of the dentine of the tooth, that's the hard substances. It follows a process. We have the laying down, the process whereby it will become hardened, the process whereby water will be removed from it so that it gives the normal appearance of a shining, everybody has this shiny, translucent teeth. There are so many drugs that has been the list is unending, that has been implicated that when a woman is exposed to it at that point in time, it will prevent that process. And that is why you have some people that have this chalky-like yellowish appearance of a tooth, as if that tooth you want to chip off is weak or easily broken down. Or you have some that have patches, white patches all around like white opacity. This place will be white, this place will be like grayish, this other place will be like chalky appearance. Do you understand? So medications too at that stage of development can also lead to it. Even at birth, when the child is given birth to, there are some medications. Then also, let me not leave this out because of our pregnant women. When women are pregnant, they give them folic acid to be using. Some women carelessly don't use it. That can also affect the structure of the oral cavity. The absence of it has been implicated in some malformations that has to do with that aspect. So let's encourage our pregnant women to take the medication, not only for themselves, but for the child that is developing. So at birth too, right from that infancy stage, there are some children that are always in and out of the hospital. In and out. So they are exposed to several drugs. Those medication also has impact on their oral cavity. There are some of those medication that can cause dryness of their mouth. Some affect the structure of the teeth. That some like that, even as the pregnant woman is not supposed to be exposed to tetracycline up to age 8, a child is not also expected to be exposed to that antibiotics. Wow. There are alternative antibiotics that can be taken. So if a child is exposed to that, the child can also come down with the effect of that tetracycline stain on the tooth. Then some of them, because children's medication is usually sweetened to make it acceptable to them. And a medication, maybe for that, okay, for instance, now we have some chewable antacids.
Okay.
Do you understand? It is not supposed to be every time. Do you understand? People that lick all these things or chew to the point that it becomes obvious, they have it as habits. It is not a one.
Okay, so it is not a one-off thing.
Yes.
Okay.
It's just like telling somebody, don't eat chocolate. Don't, you eat chocolate now, maybe in the next 3, 4 months, 6 months, you might not even see one. Okay. You are different from somebody who does it every day. Some, they have it in their pocket, all of that. So when it's become habitual, and then, of course, when you chew those things, we also encourage, because we'll get into prevention in the course of this, you rinse it off. There are measures you can take so that their effect is not prolonged in your oral cavity, in your mouth, to reduce it.
All right, thank you. That's quite a handful, information you've given there. I'd like you to please, help us translate this to our mother tongue, Yoruba, and that's, the classes or group of medications that can affect our oral health. Àwọn oògùn oríṣiríṣi oògùn tó lè affect the oral health wa àti effect wọn gangan, ipa tó máa kó gan ní ara wa àti lẹ́yìn wa náà àti lẹ́nu wa pàápàá jùlọ.
Then, sorry that you had to interrupt me. When I will come to Yoruba again. Just give me that few minutes, because this one is very important. I was taking them stage by stage. I've talked about the prenatal period,
yes,
before birth, natal, and now let's talk about the one that affects most people, because we see that one a lot.
Okay.
Now in the adulthood, because of our parents, elderly ones that are also listening at home, is not only children.
Okay.
Some of us are on antihypertensives on daily basis, some on antidiabetic, some on anxiolytic medications, that's to relieve anxiety, and so on and so forth. They also have, some are even on anti-cancer drugs. Do you understand? Radiotherapy, chemotherapy, like that. All these ones too have their effect because of that prolonged use on the oral cavity. And we recognize that some of them will come to you that they have dry mouth. They'll say, Doctor, enumi ma ngbe. Do you understand? As if there's no saliva. Some of these drugs, like I said, affect the salivary glands. So it disturbs the production of a saliva from there. So they usually feel that their mouth is dry. Because there is reduced salivary production. Saliva plays a role of cleansing the mouth, apart from lubricating your food. They can be easily predisposed to like oral thrush in their mouth, or they have white patch white on the tongue and everything. These are the common complaints they come. Some of them can come with swollen gum, bleeding gum. Do you understand? Some of them can come with even mouth odor, because when saliva is not being produced, there is stagnation within the mouth. So they complain a lot about mouth odor. Some of them complains about deposits on their mouth, like patterns. They'll say my tongue is like this. We call it like a geographic tongue or a lightning panels. They'll have this pattern like a map on their teeth. Some part will be red, some part will be white. And then they look at the mirror tomorrow, the pattern has changed to something. So it bothers them. So when they come around, we can... So many, because of those medication. Maybe by the time we are talking about treatment again, we will be making
a reference to some of them.
So for those that are on prolonged medications too, it is possible that they have all this manifestation. So back to what you said I should do.
Yes.
Mo sọ pé láti ìgbà tí a bá ti lóyún ọmọdé tó jẹ́ pé bóyá eyín, ahọ́n, face, lip, àwọn èrìgì tá ti ń fọ́ọ̀mù wọn yẹn lẹ́sẹ̀lẹ́sẹ̀ ni bí Ọlọ́run ṣe tò síbẹ̀ pé àwọn eléyìí wọ́n á kọ́kọ́ fọ́ọ̀mù, eléyìí á fọ́ọ̀mù. Ní process tí àwọn organs yẹn tó bá ń fọ́ọ̀mù, tí aláboyún tó bá lo àwọn oògùn tí ò yẹ kó lò, or bóyá oògùn tó lò pọ̀ jù, ó lè ṣe àkóbá fún àwọn structure. Òun la ṣe máa ń rí I don't know how to say cleft lip and palate in Yorùbá.
Well, solidly the Gẹ̀ẹ́sì.
Àwọn tó jẹ́ pé ẹnu wọn máa tí ò ní complete tán bá bírò ètè báyìí, ètè yìí lè pín sí méjì. Part kan wà bẹ́ẹ̀ ni pé gap wà láàrin wọn. Ó lè lọ sórí èrìgì, ó lè wà ní àjà ẹnu wọn gan, kò ní close gan. Àmì gan lè làdé ibi imú wọn bí ẹnu kí imú àtẹnu yẹn kó jápọ̀. Ó lè cause ẹ̀. Then a máa ń rí àwọn kan náà tó jẹ́ pé eyín wọn máa ń dàbí chalk tá fi ń kọ̀ọ̀kan ní ojú pátákó, chalk àwọn ọmọ school. Á dà pé eyín yẹn á máa jẹ, á máa gé lọ sílẹ̀. Tí ìgbà tí tán bá fẹ́ fọ́ọ̀mù eyín, tí irú ọmọ bẹ́ẹ̀ bá wà expose sí àwọn oògùn tó lè cause ẹ̀, àwọn tó ń lo antibiotic tetracycline, aláboyún yàgbẹ́, wọ́n á kàn sọ fún ó yá lọ ra Flagyl àti tetracycline, ìgbẹ́ yẹn máa stop. Ó lè ṣàkóbá fún irú ọmọ bẹ́ẹ̀. Àwọn tó máa ń lo jẹ́ntúsọ yẹn, àwọn oògùn tá a máa ń fi ògógóró ṣe yín, aláboyún kó máa mú oògùn tán àgbo ògógóró. That excessive alcohol that the mother is exposed to has effects. Eléyìí sìn ṣe àwọn pé medication là ń sọ. Ṣe àwọn pé ẹni tó ń fi ògógóró lo àgbo ṣe àwọn pé oògùn ló ń lò, kì í ṣe pé ó ń mutí o. So àwọn kan tó yẹ kí a máa... Then mo tún wá sọ nípa ti àwọn oògùn táwọn dókítà ń kọ fún wa náà, bóyá àwa ta ní ìfúnpá gíga. Lára àwọn oògùn yẹn tá bá ti ń lò once for some time, lára àwọn side effects wọn, àwọn side effects ni àwọn iṣẹ́ tí oògùn ń ṣe, but kì í ṣe nǹkan tá fẹ́ jẹ́ kó ṣe nìyẹn, but oògùn yẹn máa ń ṣiṣẹ́ yẹn. Ó lè affect ẹnu wa. Àwọn míì lè sọ pé ẹnu àwọn ń gbẹ, àwọn míì èrìgì wọn lè máa ṣẹ̀jẹ̀, ó lè máa wú. Èèyàn míì á ní ẹnu rùn, ó lè kọ̀sẹ̀. Then àwọn míì máa ń ní nǹkan tá à ń pè ní metallic taste. Medication can alter the taste, your taste. So because it also has effect on it. And then severally. Ẹ ṣeun gan ni àlejò wa. Ǹjẹ́ tẹ́ bá ṣe ń darapọ̀ mọ́ wa, ètò ìlera lọ́rọ̀ lẹ́hìn lẹ́ ń gbọ́ pẹ̀lú ìbáṣepọ̀ Glo 99.1 FM àti NMA, ìyẹn Nigerian Medical Association yẹn ti ìpínlẹ̀ Ondo ń bí. Ẹ lè wò wá kedere lórí ẹ̀rọ ayárabíàṣá Facebook Glo 99.1 FM Àkúrẹ́. Ẹ dẹ̀ tún lè gbọ́ wa lórí Radio Garden tàbí kẹ́ download Glo FM app lórí Google Play Store. A fẹ́ dá tán mi náà, ẹ má yí kúrò ń bẹ̀.
ìrètí wa ètò yìí ìlera lọ́rọ̀ pẹ̀lú ìbáṣepọ̀ Nigerian Medical Association yẹn ti ìpínlẹ̀ Ondo ń bí adẹ̀ tí ń bá àlejò wa sọ̀rọ̀ àwọn ní consultant Paediatric and special care dentist ní FMC nílùú Ọ̀wọ̀ dókítà Bolanle Akinwonmi náà láti ń bá jomitoro ọ̀rọ̀ látẹ̀kan. A sì ń sọ̀rọ̀ lórí àwọn effect àwọn oògùn tá à ń lò sí ẹnu. Ó dà pé ó ní nǹkan kan tẹ́ fẹ́ bá wa fi kún kó tó di pé a lọ nípa vitamin C torí pé sọ́lédè Gẹ̀ẹ́sì wà lẹ́ẹ̀kan pé àwọn tó bá ń torí ọ̀pọ̀lọpọ̀ ọmọdé wọ́n máa jẹ́ wọ́n máa ní kó máa jẹ́ torí pé ó dùn wọ́n á ní kó ọmọdé máa jẹ́. Mo fẹ́ kẹ́ ẹ ṣàlàyé fún àwọn aráalé àwọn pàápàá àwọn tó lọ́mọ nílé àtàwọn àgbàlagbà mìíràn náà tí wọ́n prefer àti máa chew vitamin C sí kó máa gbé mi lọ.
Wọ́n á chew ẹ̀ wọ́n á tún máa la.
Wọ́n á tún la.
Vitamin C ascorbic acid ni ó ní acidic component. So ẹni tó bá mi ní kó lò lẹ́ẹ̀kan kó máa sá lọ. But àwọn tó jẹ́ pé because àwọn míì báyìí wọ́n believe pé vitamin C dá fara lóòótọ́ dá fara. So because of that náà ṣe máa ń lò. Tó má dẹ̀ tí mo bá wà lórí tébù wọn wọ́n sọ sẹ́nu wọ́n máa la wọ́n máa jẹ́ bíi chewing-gum bíi sweet vitamin C yẹn ó lè fa ihò sórí eyín ló bá ń jẹ lójoojúmọ́ because acid ni acid yẹn ó máa dissolve eyín yẹn. Then even mo sọ lẹ́ẹ̀kan pé àwọn mucosa tó line ẹnu wa pé wọ́n fẹ́lẹ́ wọ́n ti rìn so ó lè corrode kó cause local irritation kó di egbò. See apart from vitamin C yẹn náà ìyẹn tún jẹ́ kí n rántí àwọn kan tá a máa ń kán sí ẹnu àwọn medications tá a máa ń kán yàn mí à ní eyín dùn àbí nǹkan dùn wọ́n lọ mú aspirin wọ́n grind ẹ̀ báyìí wọ́n á fi sí wọ́n sọ pé kí pains yẹn lè lọ. It's meant to be swallowed. It's not a topical medication for the mouth. So tó bá ń ṣe by the time they now come to the clinic at that particular time tó ṣe yẹn they can have a transient relief kò má dùn wọn máa ló ti lọ but by the time they come á ti corrode there. You know what acid does? Á ti tún wá fa egbò. When they will now have a rebound of the pain it will now be times 2. Á wá pọ̀ ju nǹkan tó cause nǹkan tó fẹ́ prevent yẹn wọ́n ti tún wá di egbò sí orí kìnìún yẹn. So those are part of the things that ó yẹ ká máa sá fún ká má máa ṣe.
Ẹ ṣeun gan ni mo fẹ́ béèrè torí ọ̀pọ̀lọpọ̀ àwọn òbí àdèmọ̀kọ́ àwọn ọmọ kéékèèké wọn láì kàn máa jẹ chocolate àwọn àgbàlagbà míì gan jẹ chocolate kí ni torí àwọn kan wà tó yẹ pé ó ti di habitual thing fún wọn tó yẹ gbogbo ìgbà almost all the time ẹ lè rí wọn láàrin ọ̀sẹ̀ kan máa jẹ chocolate àwọn ọmọdé náà ẹ lè rí wọn gan láàrin ọjọ́ kan gbà míì kan máa la chocolate then àwọn carbonated drinks kéékèèké tí wọ́n fi sínú in tó dàbí pálí báyìí kékèké táwọn àwọn juice kékèké táwọn ọmọdé mu mo fẹ́ béèrè lọ́wọ́ yín dókítà wa ṣé àwọn nǹkan wọ̀nyí ṣó ní effect lórí ẹnu torí àwọn ọmọ míì kò sí kí wọ́n máa mú ní ojú kó kéré jù bí ẹ̀mẹrin àbí ẹ̀márùn àwọn ọjọ́ tó bá fi lọ léèwé láàrin ọ̀sẹ̀ ṣó ní effect lórí eyín àwọn ọmọ kékèké àwọn ọmọdé wa.
Ó ní effect o lórí ọmọdé àti lórí àgbà.
Kí la máa wá ṣe?
Nǹkan tó wà ń bẹ̀ ni pé anything that is excess is bad. Àṣejù gbogbo nǹkan kò dáa. Ẹ̀yin náà ti sọ lẹ́ẹ̀kan pé tíyàn bá ti ń jẹ eléyìí tó tẹ̀ máa ń bọ́dà wa jù ni àwọn tó ń ṣe repeatedly the frequency of you doing it. Because nǹkan tó ṣe àkóbá nínú chocolate ní tẹ́lẹ̀ wọ́n máa ń sọ pé chocolate yẹn àti jẹ́ àti kéyìn máa ní o àìsàn àwọn olówó ni. But nísìn ó tẹ̀ wá ń ṣe àwọn tálákà jòló lọ because we now have substitute of that chocolate in different affordable pattern for everybody. So tíyàn bá ṣe ń jẹ ṣúgà inú ẹ̀ yẹn gangan ní kókó and then the sticky nature.
Òun ló ń
fa jàmbá. Ó dẹ̀ wà nú coke ó wà nú biscuit ó wà nú chewing gum ó wà nú chocolate. Any refined carbohydrate at all. Apart from carbohydrate tó ń jẹ even nínú bread bread has refined sugar. I had a patient recently tó yẹ pé nǹkan tí tóun máa ń ṣe ni pé ó máa ń gbé bread sẹ́kẹ̀ á jẹ á dẹ̀ sùn lọ. So ó wá pẹ̀lú different kind pattern of holes and problem with it. So nǹkan tá a máa ń advice ni wípé you limit your frequency, the intake of all these things if you don't want problems from them.
ẹ ṣeun gan ni
And you
dókítà.
know it is not also healthy for the general health apart from the teeth. Too much
Obviously.
sugar, yes.
Obviously. Okay, how about, are you now suggesting that they should take this thing once in a while, not regularly? What, there are some persons who cannot do. I know people who cannot do without taking Coke, biscuits, especially children, biscuits. So, and most of us, we ate all of these things growing up. Are you saying these are the causes of, where we have most adults with teeth problems these days? What do we do? Because children cannot do without taking biscuits.
Children can do without taking biscuit. It is
What
your
are
determination.
alternatives? Okay.
We have fruits.
Okay.
I deal with children a lot, and
Okay.
I always tell parents, you see, when the chips are down, you yourself, you know there's nothing anybody cannot do without. You said in our days we take Coke. Yes, in our days we take Coke, but not as they take it now. Then you only take Coke when there are ceremonies. We don't have, but now it's affordable to everybody, even in different quantities. And we also indulge these children with them. So instead of giving them this ketogenic diet, that's these sugary things, we can substitute with our natural fruits. Things that are not refined, carbohydrate. A child, my children went to a school, then a private school, and it was their policy that you don't bring in biscuits, you don't bring in sweet, you don't bring in juice into that school. You only bring your food and water. They spent 5 years in that school and nothing happened. And everything comply. Even if you put that biscuit in their bag, they are the ones that will tell you that, Mommy, this is a contraband. That's what they call it in that school. So I don't want to go with the fact that a child cannot do with a biscuit. Don't indulge them. Even if you will give them, let it be once in a while.
I hope our parents are listening at this time, even if you have to give your children once in a while. And let them do without biscuit. Let them know natural fruits and food and water. So we hope we now live with them, because this might be a little bit or seem a little bit impossible for parents who are used to, especially children who cry a lot. Just take this and let me rest.
It's indulgence still. You see that, but because by the time the child comes down with a problem and the chips are down, they eventually comply. But this time around under duress. The child still cries, but the mother will not give, because she knows what she has gone through because the child was in pain. She knows how much she has spent. The school days that the child is missing, even the child himself or herself knows what he had gone through because of that. There are even some of them that will remind their mommy when somebody gives them that doctor said I should not take it again. So if we put our hearts to this and allow ourselves to be educated, we can actually get there.
So it's possible.
It's possible.
All right, so mo fẹ́ kẹ́ bá wa ṣàlàyé àwọn nǹkan kan wà tẹ́ni ká máa èdè Gẹ̀ẹ́sì láti sọ gbogbo wọn ká máa fún wọn. Torí àwọn táwọn tó ń gbọ́ wa nílé káàkiri gbogbo àgbáńlá yà wọn kan èdè Yorùbá, èdè abínibí wa ni wọ́n fẹ́ láti lọ́ máa lè digest ẹ̀ dáadáa. So fún àwọn tó ń gbọ́ wa tó dẹ̀ pé àwọn fan àwọn èdè abínibí wa ni wọ́n, mo fẹ́ kẹ́ ṣàlàyé àwọn nǹkan tí àwọn òbí lè ṣe kó má tẹ̀ fún ọmọ tó ti ń fún àwọn ọmọ tẹ́lẹ̀ tí wọ́n ní lè fún àwọn ọmọ mọ́, tàbí nǹkan tí òbí gan àgbàlagbà gan ń fi sẹ́nu tí wọ́n lè ṣe láì lò, tí àwọn substitute àwọn nǹkan tí wọ́n lè lò, nǹkan tó lè ṣe ká lè ní ìlera tó péye fún ẹnu wa àti eyín wa.
Eléyìí tá a sọ ni nípa oúnjẹ tá à ń jẹ, and a dẹ̀ wá fi attention wá sí àwọn oúnjẹ tó yẹ pé wọ́n máa ń ṣe ìpalára gan fún ẹnu, and mo tó wá pé kì í ṣe ẹnu nìkan because ní èdè òyìnbó ní medicine wọ́n ní multiple risk factors. So bó ṣe ń affect ẹnu ló ń affect ojú, ló ń affect ọkàn, ló ń affect liver, ló ń generally so pé kíyàn máa jẹ ṣúgà lájẹjù, ó yá nínú chocolate ni, nínú biscuit, nínú sweet, nínú chewing gum, tó bá ti pọ̀ jù, because tó bá ti jẹ àwọn kinní body wa ó ní tendency pé kóun overcome effect ẹ̀. Like we said, the sugar will be broken down. Sugar yẹn a máa gé padà sí acid yẹn gangan ló máa ń fa wàhálà yẹn. The body is wired pé a lè neutralize acid yẹn, so the body pH á padà sí normal. But fún èèyàn tó jẹ́ pé gbogbo ìgbà kí body ẹ̀ tó neutralize acid yẹn ó ti tún jẹ mí, kó tó neutralize ẹ̀ ó ti tún jẹ mí, kó tó neutralize ó ti, so the balance yẹn ó máa shift towards that negative aspect. So I override the positive aspect. Ó ṣe nǹkan tí ó dáa, body ẹ̀ correct ẹ̀ ó dá padà sípò. But tó bá di pé gbogbo ìgbà ló ń ṣe nǹkan tí ó dáa yẹn, so the body will shift towards the diseased process. So àwa ní pé àwọn ọmọ wa ẹ má jẹ́ ká indulge wọn pẹ̀lú ìjẹkújẹ nípa biscuit, nípa chocolate kì í ṣe oúnjẹ ojoojúmọ́. Àjẹjẹ kò dá fàgbàlagbà, kò dá fọmọdé, and kì í ṣe chocolate nìkan. Mo wá sọ wípé tẹ́lẹ̀ wọ́n láwọn olówó ló máa ń ra chocolate. Nísìn pẹ̀lú 50 naira wàá rí chocolate rà. It is your state. Gbogbo ẹ̀ náà àwọn candy lóríṣiríṣi, àwọn pọ́ngilá, kì í ṣe supermarket nìkan náà ti ń tà ládùúgbò. Ó wà ń bẹ, ṣúgà ló wà nù gbogbo wọn. Ó dẹ̀ ń ṣe ìpalára. Pé àwa òbí, instead of that, ẹ jẹ́ ká máa fún àwọn ọmọ wa ní fruits, healthy snacks, nuts, groundnuts, àgbálùmọ̀, ọsàn, fruits tó bá wà ń tà that are even cheaper, we can afford, and it's healthy. Á ṣe ara lóore, á ṣe ẹnu lóore fáwọn ọmọ yẹn.
Ẹ ṣeun gan. Ṣé mo kó àwọn fruits kan náà wà tí wọ́n ní sugar díẹ̀, but they are natural? Ṣé àwọn yẹn wà advisable? A lè rọ́mọ mi tó máa jẹ́ pé àbí ẹlòmíì àgbàlá tó jẹ́ pé mango.
They are not refined sugars.
So they are healthy.
Yes, they are
and
healthier.
You can take
they are
healthier, and they can take as much as they can
compared to the refined ones.
Ìyẹn náà lẹ ti ń gbọ́ látẹnu àlejò wa Dókítà Bolanle Akinwonmi. Àwọn ni consultant pediatric and special care dentist FMC ti ìlú Ọ̀wọ̀. Let me quickly ask you, ma'am, what measures can we take if we need to take these medications in order to reduce their effect on our oral health?
Yes, very good. The measure to take is let's start from everybody generally. Everybody should maintain good oral hygiene. Everybody. Ká máa ṣe ìtọ́jú ẹnu wa lóòrèkóòrè. Ká fọ ẹnu wa láàárọ̀ àti lálẹ́ lójoojúmọ́. Tá a bá tẹ̀ lè ṣe àárọ̀ àti lálẹ́, a lè ṣe kan lójúmọ́.
Kẹ́ tó tún mọ̀ pé nǹkan tẹ́ fẹ́ sọ pọ̀. Bẹ́ẹ̀ ṣe ń sọ ni wọ́n máa mú lẹ́yẹ kankan. Àárọ̀ tẹ́ sọ yẹn, àwọn kan ti ní wọ́n ní ká máa fẹnu wa lẹ́ẹ̀mejì ni o. Wọn ò ní kẹ́ tó jẹun, wọn ò ní lẹ́yìn oúnjẹ ni. Mo fẹ́ kẹ́ ṣàlẹ̀ because mo mọ̀ pé area yín nìyẹn. Ẹ bá wa sọ fún àwọn aráalé, ṣé ká tó jẹun ní àárọ̀ ní ká fọyín ni, àbí lẹ́yìn tá a bá jẹun tá a tún lè fọyín lálẹ́? Ṣé tá bá ti jẹun tán ní ká fọyín ni, àbí ká fọyín tán lẹ́yìn tá a bá fọyín a tún sì lè fi nǹkan sẹ́nu? Mo fẹ́ kẹ́ ṣàlàyé àwọn nǹkan yìí tí ń fa misconceptions. Tẹ́lẹ̀ ṣebí ká ti fọyín ni, mo bá fọ ní ọ̀sán kí n tún fọ ní ìrọ̀lẹ́, kí n má fẹnu láàárọ̀, pé dédé ẹ bá wa yọ̀nà náà fún ara rẹ̀.
It's okay. Ṣé wọn pé oríṣiríṣi ìdí la ṣe ń fọ ẹnu? The most important thing ni a máa ń fọ ẹnu kẹ́nu wa má bàa rùn, kó má bàa dọ̀tí. Then à ń fọ ẹnu torí ká má bàa ní àìsàn nínú ẹnu tí dọ̀tí bá wà níbẹ̀. Bí àwọn oúnjẹ tó bá fọ, ó lè fa àkóbá lórí kòkòrò máa wà níbẹ̀. So àti kọ́kọ́ sọ àwọn ìdí tá a fi ń fọ ẹnu. Then a tún fọ ẹnu káwa fúnra wa ká lè feel okay. You know, that self-confidence. Then the aesthetics, pé kán rí eyín mi kó funfun kí inú mi dùn. Ìdí tá a fi ń fọ ẹnu nìyẹn. So torí àwọn ìdí tá a fi ń fọ ẹnu yìí, ìgbà wo ni mo wá fẹ́ fọ ẹnu mi? 1, torí kí ẹnu mi má bàa dọ̀tí. Tí n bá ti jẹun tán, màá fọ oúnjẹ tó wà nínú ẹnu mi, àbí àwọn ilé tó bá kù síbẹ̀ màá fi brush fọ dànù. Torí kí ẹnu mi má bàa rùn náà, màá fọ ẹnu mi. Torí tí oúnjẹ yẹn tíyàn bá ti jẹun tán lálẹ́, kó oúnjẹ má bàa ṣẹ́kù sí ẹlẹ́nu, so that àwọn bacteria ò ní ṣiṣẹ́ lórí oúnjẹ yẹn overnight, kan metabolize ẹ̀. We say before you sleep at night, go and wash your mouth. That one is settled. kò sí. And once you have washed your mouth lálẹ́, má tún jẹun mọ́, momi kó lọ sùn. Má fọ ẹnu tán kó lọ mu kóòkì, má fọ ẹnu tán kó tún lọ jẹba, má jẹ anything má lọ sùn. So when you now wake up the next morning, you know you are waking up with a fresh mouth, no food impact or anything. Now comes the second thing to address. A ní à ń fọ ẹnu kẹ́nu á má bàa rùn. Gbogbo wa tá bá jí láàárọ̀, because of that night long stress, the saliva had been quiet. It is possible for your mouth to have a bad breath, which some people cannot take. And the first thing they want to do is to go and take their brush and brush their mouth. It is acceptable. But when you eat, rinse and go your way. You know, that means mo ti fọ ẹnu, mo jẹun, mo rinse. It is acceptable for the morning. There are some people that they don't mind. They can just rinse, eat, and when they want to have their bath and anything, they go and brush after it. It is also acceptable. Do you understand? What science is proving now is that when you have somebody that is doing something perfectly and it's working for the person, you will only reinforce. You don't say, you must eat, you must brush before eating. Some people cannot put anything in their mouth. They will vomit if they have not brushed, if they have not. So let them go ahead with what they are doing. But the moment you finish eating your breakfast, just rinse your mouth so that you don't have food debris left in your mouth, and then that fresh breath. But the one of saying látàárọ̀ di ọ̀sán, tó bá wù mí mo fọ lọ́sàn-án ò fọ látàárọ̀, your mouth will smell now. You have mouth odor, and that will be unacceptable to you and even to others looking at you. Do you understand? So we recommend last thing at night. Then in the morning you must brush either before or after breakfast. But after your breakfast, take water and rinse if you had brushed early. So it will help you to maintain a fresh breath.
Thank you very much, Dr. Bolanle. Thank you for doing justice to tonight. We hope that those listening at home, can take a cue from what our professional has said this morning. So let me ask you again. Aside from all of this, what advice would you give?
We are still talking about things to do about the medication.
Okay, you are not done.
Yes.
Yeah, okay.
Because
I like the fact you take it. You take things one after. Let me give you time. You have the floor.
Thank you.
Yes, ma'am.
Thank you. So we are talking about. So I said for everybody, you maintain that good oral hygiene, so that you can have that good health of your oral cavity. Then, the second thing is that regular dental checkup. Just like you have a car, you want to maintain it. What is the first thing? Maintenance. Start from regular servicing. You know that after I have moved this mileage, I should service my car. You don't have to wait for it to start giving fault or knock down before you. So we don't have to wait till there are problems in the mouth. Everybody, either you're on medications or you are not on medication, at least twice in a year, see your dentist, once in 6 months, just for checkup so that they can maintain it. Now we are talking about the effects of medication. There are medications that are no for a particular period. Like I've told you about this pregnancy thing. Well, that's why they say pregnant women don't self-medicate. Seek counsel before you take any medication from experts, so that you don't jeopardize your health and that of that unborn child. So get information like what you are doing now, educating them. At least if somebody has not heard to them, I say from pregnancy to when a child is 8 years, don't expose them to tetracycline. Use other alternatives. Do you understand? I've talked about some pregnant women that has to do anticonvulsant or anything. Discuss with your doctor, either your gynecologist or the one that is managing you. They know how to weigh the benefit of that drug to the disadvantages, and then they give you the options. You both agree and do it. There are some that are like the antihypertensive drugs. If the effects it's so enormous on the patient, like some that say I have dry mouth, I have repeated candidiasis, my mouth is, some even have these peppery sensations. We call it burning mouth. So what we do when they won't present to their doctor with that problem, they'll present to the dentist. And by the time we take our history, we find out that this is the drug they are using. What we'll do is to liaise with their physician. Do you understand? If it is something that they can change to give another brand with the same work, they do that. But in cases where they cannot change, we can now manage the symptoms. There are things to do. Like those that are having dry mouth, there are artificial salivas that can be given to them that they will use. There are soothing drugs, drugs that can treat that effect or limit the effect of that drug. So that is why we encourage our people that regular visit to the dentist and then consultation to your physician to ensure that you are doing the right thing is also there. Then for those with all these systemic illnesses like diabetes, hypertension, on regular medication, they should come in for professional cleaning, which we call the scaling and polishing, once in 6 months. So if there are issues that are building up, it can be developed early. And then, this one is another topic on its own.
It can be detected early.
It can be detected early. This one should be another topic on its own. But because we are talking of this medication now, I still have to just point attention to it briefly. Some of these diseases themselves that the medication are being used for, they have their own effect on the oral cavity apart from the medications. So by the time you present yourself at the clinic, no pain, nothing, just doctor, please just check on me. Then if there are issues, it can be detected. And
very quickly, just before you continue, for those who try to reach us, please, you can then call. I think we can, interrupt our conversation now. Okay. So when please do all to call us back. Those who tried to reach us a couple of minutes ago, do all to call us back. 0805 551 1110 or 0706 677 1822. We can just take one or two more calls before we go. Okay. So go ahead, ma'am.
So I said you do the regular check. And then another thing is the use of your toothpaste, very important. Make sure that the toothpaste you're having, you want to have a good oral health, contains fluoride. It's very important. There are so many all around now. You have the free will to choose whatever you want to use. But make sure in addition you have a fluoride containing toothpaste that you are using. So with all this, I think you will be good to take care of it.
Thank you very much. Just as we round off on the program this morning, what you've just said in English, I would like you to please, relay that in our mother tongue, and then your general advice to listener at home.
Ṣé nǹkan tá à ń sọ ni wípé gẹ́gẹ́ bá ṣe ń sọ látàárọ̀, àwọn aláboyún wa a ní kó máa ṣọ́ra fún bọ́n ṣe ń lo oògùn sí, so that wọn ò ní ṣèpalára fún ara wọn àti àwọn ọmọ. Oògùn tán bá fẹ́ lò kán béèrè lọ́wọ́ dókítà wọn pé ṣé mo lè lò ó, ṣé ó safe, àbí tí anybody bá tẹ̀ kọ oògùn fún wọn, particularly àwọn tó ṣẹ̀ṣẹ̀ máa ń lóyún yẹn, wàá sọ dọ́kọ̀ lè gbàgbé pé má béèrè lọ́wọ́ ẹ̀ pé ṣé o lóyún. Do you understand? Sọ fún pé dókítà mo lóyún o, ṣé aláboyún lè lo oògùn yìí, ó mọ nǹkan tó máa ṣe. Then a ní pé ká máa wá sí ilé ìwòsàn fún ká máa yẹra wa wò, see your dentist. Lọ́sọ̀ má dúró dìgbà tí eyín bá ń dùn ẹ́. So that access to dental care, pé kán bá ẹ wò yẹn, if there's any problem tó fẹ́ ṣẹlẹ̀, wọ́n á lè tètè rí. Then mo wá ní àwọn tó bá yẹn pé oògùn yẹn ti ń ṣe ìpalára fún, bóyá àwọn màmá wa ẹnu mi ń gbẹ, èrìgì mi ń ṣẹ̀jẹ̀, and so on and so forth, wá sí hospital. Bá doctor ẹ sọ̀rọ̀, tó bá délé tán lè change oògùn yẹn ni wọ́n á change ẹ̀. Tán bá dẹ̀ lè change oògùn yẹn torí bó ṣe important sí. Àwọn nǹkan kan wà tá lè fún ẹ, búrú àwọn tẹ́nu wọn gbẹ yẹn sìn, á ní àwọn artificial ìtọ̀ àbí àwọn oògùn tán lè fi increase kí ìtọ̀ máa wà lẹ́nu tó jẹ́ pé wọ́n lè fún ẹ. àbáwọn kan tí wàá lè máa ṣe.
ẹ ṣeun gan ni dókítà wa a ní ìrìjú báyìí lọ lórí ètò ìlera lọ́rọ̀ pẹ̀lú ìbáṣepọ̀ Nigerian Medical Association ti ìpínlẹ̀ Ondo ń bí ọ̀sẹ̀ tó ń bọ̀ ló tó dá ọpẹ́ pàtàkì ẹ ṣeun gan kó àpè yìí consultant Paediatric and special care dentist FMC tìlú Ọ̀wọ̀ dókítà Bolanle Akinwonmi ẹ ṣeun gan tẹ́ wá sórí ètò lónìí.
Thank you.
Until some other time next week when we come again with another topical issue that surrounds our health, remember to take